Now, the world has been in pandemic mode for nearly 9 months now, and as the virus lingers, we're still learning about how to live with it. So we all remain cautious going into the fall and the new school year. Experts are now reflecting on the best lessons we're learning to keep schools moving forward and children learning. Joining us now to share some perspective on health and safety protocols and how to equip children emotionally for new routines and schedules is Dennis Maple of Goddard Systems, along with pediatrician Dr. Jack Maple. Thanks for coming to the show. What safety protocols should parents be looking for when we talk about child care centers?
Hi, Aubrey. So we're glad to share our insights. Since the very beginning of the crisis, we've been looking at ways to keep our physical space safe for kids, making sure that our staff is trained in being emotionally supportive, as they always are. And really, there are a number of protocols that parents should expect to see in a Goddard school. The first is when you bring your child in, you're going to be met at the front door by a smiling staff member. They're going to do a quick health assessment of your child to make sure that they're ready to start their day. Included in that assessment will be them doing a temperature check. We want to make sure that no one enters the building with a fever. And of course, this is something that both students and faculty will encounter each day that they come into the building. Secondly, one of our staff members will then take the child to their classroom for the day. They'll be with the same group of kids, the same teacher. And in that classroom, you'll see things like a rigorous focus on sanitation, making sure that high-touch areas that kids routinely play in, are kept clean and free of any potential virus content. You'll also see us really focusing our students and others on the importance of personal hygiene, things like covering your mouth when you have a sneeze, when you have a cough, making sure that there is social distancing in the room. And the most important thing, of course, is washing their hands, because we know that kids like to put their hands in their mouth and on their face. And so the importance of washing hands is as big now as it's ever been. Dr. Jack, I'm sure you've got some comments as well from a medical perspective.
Sure. I think everything Dennis is describing is really what we might regard as best practices. It's really drawing from CDC guidelines and other state and federal recommendations for keeping kids safe. So it's really about layering those protections, about hand washing and social distancing and relentless cleaning and communication. All of those things add up to create an environment of safety for kids and awareness of families so we can spot kids who might be having issues early and really support each other in getting kids who need to be evaluated appropriately to where they need to go, and allowing the broader group to thrive and be kids and enjoy their day and each other.
What about parents and helping them prepare their young children emotionally for that return?
So, Aubrey, I'm glad that you asked. At Goddard, we've created this video series called Parenting Under 5. It's a series of 9 videos. They're about 5 minutes apiece. And what we're doing in these videos is we're leveraging the insights and the perspective of medical professionals from around the country. In particular, we're talking about things like COVID-19. What should parents look like? What are the symptoms? When is it appropriate for kids to return to school? And as you say, how do you prepare your kids for returning to school? So we think it starts with the communication. Additionally, on our website, you will find tools and information that will help you either simulate practice or convey information to your kids so that they're prepared for what differences they may see once they're back in our schools with us. So we've got a pretty comprehensive approach. Dr. Jack, I know this question's come up before. We talk about it all the time.
Yeah.
What would you like to add there?
I think that parents can take tools like this and then try to create or mirror situations at home that might prepare kids and the family for just the new regime or the new normal if it's a first time back to school since last spring for certain children. So those things like hand washing or being sanitary or working on tolerating masks for kids who are age appropriate, all those things together families can model, parents can understand, and then in turn build confidence and possibly reduce anxiety for kids who are re-entering the school space. And I think we'll all be surprised by how resilient and adaptive our kids are. I think they'll teach us a lot at the process.
Yeah, we're always learning from the kids, no doubt about that. And no doubt that the pandemic has changed the way we teach and engage with our children. What about with cold and flu season approaching? How can we prepare for that as well?
How can people prepare for, I couldn't hear the end of cold and flu. So I think cold and flu really dovetails pretty similarly with COVID. All of the operating protocols that we talked about the social distancing, cleansing of surfaces on a religious basis, making sure that we're practicing safe hygiene. Those are all really important things that we should do in our schools, that we've trained our faculty at Goddard. I know, Dr. Jack, we've talked a little bit about other things that parents can do, such as vaccines and so forth. Can
Certainly.
you expound a little bit?
Absolutely. So I think everything Dennis described is sort of like the critical foundation for safety that we're all talking about here. And then as a pediatrician and as someone caring for kids and their families, I have to say I advocate that everyone of age 6 months and older who is eligible get a flu vaccine. So that's not just the children who are the patients here, but also family members, brothers, sisters, aunts, uncles, and grandparents, to create really a zone or a cocoon of safety around these kids. All these things together are one more buffer or layer against contagion and spread of infection to keep our communities, our families, and our faculty safe.
And I know that one thing that's really been brought to the forefront is the critical nature of childcare to the U.S. economy.
Yeah, we like to think of ourselves as the workforce behind the workforce. For instance, at the beginning of the virus, many of our schools remained open at the request of local governments so that we could provide childcare support for essential workers. That support is still needed today as people begin to think about returning to work in person, or frankly, if they're doing work at home digitally. It's important that people know their kids are going to be in a safe environment. They're going to be nurtured. They're going to be socially interactive with their friends and others. And so this is just really an unprecedented time, but we're trying to do our best, giving tools and resources, information, and support to families and ultimately to kids as well.
And when we talk about some of the changes and the adjustments that we've had to make during COVID, especially where children are concerned, where education is concerned, do you think some of these new opportunities to develop different procedures are here to stay?
I certainly think in the interim they are. I think we want to continue to learn as much as we can about the spread of COVID-19. We want to make sure that we're adjusting and being flexible with our interim operating procedures. But I think certainly for the foreseeable future, people can expect that when they're in a Goddard school, we will be strictly adhering to the CDC, state, and local guidelines to protect children.
And Doctor, did you have anything to add?
I would add that I think yeah, absolutely. I think I would add that we really need to I think pace ourselves and consider this a long-term prospect, as Dennis said. And so kids of any age going to any school, I think we as families, as community members, should keep up our vigilance and keep up our effort to be aware, to understand that information is changing and that we're learning. And schools like Goddard and others are applying new and sometimes changing practices. So we have to really compel ourselves to be up to date and to keep each other updated as possible.
All right. Well, I want to thank both of you for joining us on the show this morning and providing that information. If you want to learn more about Goddard School's perspective, you can check out goddardschool.com.